Hello, Dr. Mini PG, Specialist Gynecologist, RUKN Medical Center, Ajman. Today we can discuss about postmenopausal bleeding. After cessation of the menstruation for 1 year, if a patient bleeds, that is called postmenopausal bleeding. It may be a little spotting or a moderate bleeding or heavy bleeding. The reasons for postmenopausal bleeding are lesions or erosion or polyp from the cervix, endometrial thickness, endometrial infection, endometrial polyp, endometrial myomas, or some cyst or tumor in the ovaries. This postmenopausal bleeding, we should take it a little with caution. If a patient is having postmenopausal bleeding, that should not be ignored. A gynecologist should be consulted. Gynecologist will look for cervical lesions, vaginal lesions, and it will do a scanning, ultrasound scanning, preferably transvaginal scanning. That scanning will measure the endometrial thickness, and sometimes it may be more than 5 millimeter. If it is more than 5 millimeter, that should be further followed up and investigated. With the scanning, any polyp or any myoma, endometrial, any other lesions can be detected. The scanning can detect the tumor or cyst in the ovaries also. If the endometrial thickness is more than 5, that thickness should be tested, that is biopsy should be done. We can have biopsy by 3 means, like endometrial pimpling, that is through a syringe and cannula we will aspirate the endometrium and send it for biopsy. Or we can have a dilatation and curettage, that is done under anesthesia, and after dilating the cervix, one curette is inserted inside the uterine cavity. That endometrium will be curetted and sent for biopsy. The gold standard investigation for postmenopausal bleeding is hysteroscopy and biopsy. Hysteroscope is a telescope with a camera that is inserted inside the uterine cavity and visualized the uterine cavity properly. Any abnormal lesions should be biopsied, and that biopsy specimen sent for pathologic evaluation. If anything abnormal, that is cancerous lesions, means that patient should be evaluated with the oncology team. If a precancerous lesion, means we have to remove the uterus and ovaries. If no problem with the biopsy, everything normal, means that patient can be followed up later on after 3 months. Again this ultrasound scanning should be done and repeat the endometrial thickness measurement, and if it is below 5, no problem at all. But we should be little cautious and careful about the postmenopausal bleeding, because 10% of chance for cancer is there for the this postmenopausal bleeding.